Toy, thank you. Well, as men get older, our bodies certainly change, and for some, that could mean facing erectile dysfunction. Joining us this morning to talk about that is Dr. David Cheese, urologist at the Urology Centers of Alabama. Good to see you this morning, talking about the facts.
Thank you for having me, Mike.
Yeah, I mean, obviously, it's a delicate issue to talk about, but it's very common, and then maybe that's unfortunate that we don't talk about it enough, because a lot of men, they might be ashamed of what they're going through. That affects intimacy and relationships, and we really should be able to talk about it openly. Right?
Absolutely. It should be something that we should be able to talk freely. It is something that's a hard subject to broach for a lot of men, but it's something that's important in everybody's lives. So if the more we can get people to open up about it, the better. So
what are the major causes of ED? And I also mentioned age, but this can happen to somebody younger too, right?
It certainly can.
Yeah.
You know, the statistics are estimating probably a prevalence about 1 in 10 men up to the age of 40 that might experience erectile dysfunction, and that seems to increase about 10% per decade of life after that.
And what is common, you know, what is the reason behind ED normally? Is it loss of testosterone? Is it just that getting older thing?
I would say the most common cause in the United States is probably just because of a decreased ability to get vascular blood flow down to the penis. And so that ends up being things like hypertension, heart disease, things of that nature. That's definitely the most common.
So the normal things that help us in health, and that is, you know, exercise, good diet, and trying to lose weight if we can, if we're obese, that those factors will help in that situation.
Absolutely, they will, for sure.
All right, is ED permanent?
It's not necessarily permanent. I would say if it's an organic cause, generally it's very difficult to spontaneously resolve. Usually there will be some sort of treatment that's necessary. There are some newer treatments that are out there that are working on trying to restore kind of the natural erectile function that you would expect from a younger man, but those are still experimental, but they are out there.
Obviously, I'm sure you're well aware, you see commercials all the time for some types of treatments that may not necessarily be approved by the FDA or peer-reviewed. What are some treatments that we know to work?
What we know to work for sure are treatments that I kind of talk about in the office. They're kind of like Band-Aid solutions. They're to help you adjust, but not necessarily be able to cure the underlying issue, but definitely get men to the point where they're happy and they're able to function like they would expect to. Most commonly would be things like medications, oral pills, things like you've heard of, Viagra, Cialis, things of that nature. But there are also other things that are a little bit more invasive and cumbersome for the patient to use, but can be a little bit more effective than pills. Things like injections into the penis, and also things like using vacuum erectile devices to help get an erection.
And you mentioned the pills that a lot of people are very familiar with. They're very common now. Are the side effects of those rather dangerous? You know, is it something that really only affects a small percentage of those who take that?
Side effects are not terribly common, and generally they're not terribly dangerous either. You'll usually see things like headaches, usually bad enough where you won't want to have a fun night out with it. Sometimes can cause issues with flushing in the face, feeling lightheaded. Sometimes can affect vision, but usually you don't run into any serious issues. Rarely do you run into issues like they have in the warnings you hear on the commercials where you have an erection lasting longer than 4 hours, seek medical attention. That's a very rare effect of the medications.
And some people might be familiar with a movie involving Jack Nicholson and Diane Cannon where he has a heart attack, goes into the emergency room, and they're getting ready to throw some nitro in there to make sure his heart's okay. And they ask him beforehand, "Sir, have you been taking anything for ED?" And he said no, but he had. That is where it could become an issue, or is that fictional?
No, that's definitely a true possibility. We worry about that because the combination of those two medications that rescue for heart and chest pain and the ED medication can precipitously drop blood pressure. So that is a true contraindication. But we usually are screening men beforehand before we decide to start them on the medications for heart problems. And it doesn't mean that they can't get the oral medication, but we just have to be careful.
All right, well, I think the good news is for men who are dealing with this, obviously you can go see a urologist, get some answers to your questions, and not feel ashamed about it, because again, it's just a normal human thing that happens to some folks. Dr. Chi, we do appreciate it. Thank you so much.
Thank you very much, Mike. Appreciate it.
All right, JJ standing by.